Meta Brunzema. I'm an architect and urban designer with the Collective for Community, Culture and Environment. We are a group of 21 women, planners, urban designers, architects, engineers. We also have policy specialists in the health and transportation sectors. I'm also a professor at Pratt in the Graduate Architecture and Urban Design program, and I have my own practice in Hell's Kitchen, Manhattan. Hi. I have been interested in public health issues for many, many years. However, I have to confess to this group of specialists that I am not a health specialist, either a health policy specialist or a special health designer. I design public spaces, fairly large parks, urban spaces, buildings, interiors, and so forth. And I have done that for many years. I have recently gotten a grant from the New York State Health Foundation to test a new kind of design method looking at public health in Chinatown. So public health has been on my mind, and mental health particularly. When I saw the question that I was asked to speak about, I thought that the answer was pretty obvious, okay? It is definitely, the built environment is definitely a determinant of mental health. And reviewing the literature and knowing what I know that most of you in this room believe this, and you've all seen many, many design reports, many best practices, and I've learned a lot from them over the years, and I appreciate the work that the city and many other foundations are doing to advance the knowledge, working with medical professionals and public health professionals. What I'm going to speak about today is basically weaving some of these, some of this knowledge and checking it against my, knowledge as a practitioner, and posing some questions, actually, because I felt that some of the literature is not reflecting the possibilities for public health that are more comprehensive than the sort of step-by-step or sectoral approach to design guidelines or policy guidelines. I wanted to also go through a little bit of definitions and sort of debunk a little bit what I feel about some of the terms that are in this very sentence. So we have mental health. Most of you know that René Descartes came up with this idea of mind-body dualism. The mind was for God and the body was for the physician. So that led to the idea that mental health and mental illnesses were to be seen sort of separately. And we have the idea of institutionalizing mental diseases and psychiatric diseases that comes really from, multiple hundreds of years of thinking of the mind and the body separately. Most of you, of course, no longer think that way, but it's important to remember that a lot of people still think that way in society. And that is something that we constantly need to be reminded of and to reiterate in our own work. So I wanted to see mental health versus mental illness, because I think today we're going to be talking primarily about mental health and also about mental wellness. But I believe, we need to be reminded that mental health is something to prevent the mental illness. And the reason I just pointed out these, and these come from the Center for Urban Design and Mental Health, is to be able to speak to them a little bit later on. And as you can see, cognitive and social skills, if you were to mention that not in this setting, nobody would really recognize that that is about mental health, right? So I've always felt that mental health and health were really not that far apart. And so and even, you know, the ability to empathize and so forth, you know, is really a deeper aspect of one's personality that gets developed at the same time as mental health. And that is a little bit of a prelude to what I will be talking about later, when I will be addressing what I consider a more comprehensive approach to looking at mental health. So here we have mental illness. You are all specialists. I'm just flipping this. You know, depression, anxiety disorder, you know, everything from very serious diseases to diseases that have a great gradient of gravity. Okay. You all know 1 in 4 people are at risk for psychiatric disorder. And interesting to me is that most of them start very early. So the idea of actually thinking of mental diseases as something that percolates in one's body, that sometimes develops many years later, was something that I thought should be brought up in this setting because it might lead to some more interesting discussions later on. Because obviously we're all here and we're pretty convinced that prevention rather than treatment is what we ought to be going for. But to know that is fairly interesting to me. So most of you also know that psychiatric disorders are more concentrated in cities and that they are very heavily correlated with insecurity and isolation. But at the same time, cities also have positive aspects that counter that. So there's no clear line, and I know that all of you know probably much more than I do about this. But I wanted to, since we're going through all of these definitions, put this on the table in this presentation. Now, since we started with a dualism, right, I also wanted to address the built environment component of my talk here. So what is built environment? Are we talking about buildings? Or what is, or are we talking about nature as another kind of environment? And what I'd like to argue here is that, you know, nature to some degree is really all built and is all cultural. And the image that you see here fairly faintly is an image of Central Park, which, you know, certainly has natural outcroppings, but isn't in 100% design space, okay? And many interesting artists and architects have tried to break the barrier between nature and culture. And I'll show you an example here. This is the artist Natalie Jeryomenko that is very interested in breaking down the barrier between nature and culture, but also actually having changing the relationship of who benefits. Because when we talk about public health and people using parks and people breathing well and people running and doing all the good things that we all want people to do, right, to exercise, but when do we ever give back to nature? So this particular project is called Tree X Office, and she has many more projects that sort of try to bridge the nature culture. And what happens here is that people, this is a sort of a little outdoor office that people can rent, or, you know, and the benefits of that rent, the money or the whatever the revenues from this enterprise actually pay for restoring the tree. So there's an idea here. She also had another project that I always found very interesting, which was a dinner party for birds and people. And she found a way of finding food that actually basically works for both, and so forth. And because, you know, as she's of course an artist, but I believe we can learn from all of that because, you know, we talk a lot about nature when we talk about public health. And I feel like it's always sort of like we want, of course, more of it, but to give back to it is also a very important component of this sort of more holistic dialogue. So we're again trying to break, at least I'm trying to sort of debunk a little bit this dualism. So I looked at the Center for Urban Design and Mental Health and found that there are a number of well-known and well-agreed-upon determinants of mental health, which I decided not to discuss because you all know them. Right? The green space, the active space, the pro-social spaces, the safety in the city. We have more. Sleep, transportation and connection, meaning adequate and good transportation that doesn't make you stuck in traffic and so forth. Economic stress and affordability for housing in particular, and air pollution. So I just put these on the slide so that we have them in the back of our minds. But I also found that there were things lacking a little bit. And there were issues that were a little bit buried within this language. One of the things that I've been struggling with in my recent practice, and also the Chinatown project that I mentioned to you, which is a project that I'm working with my collective partners on a special district for the waterfront of Chinatown, which involves a lot of low-income tenants and a big threat of displacement. What we found, and there are many races, there's Latinos, there's whites, there's Chinese Americans and so forth, and the word diversity comes up a lot. So in my research about diversity and social inclusion, I found an inverse relationship. This explains quote-unquote racism, okay? In other words, the more diversity you have, the less sense of community, of inclusion you have. I mean, I'm showing this, and if any of you can argue with this diagram, I'd love to hear about it, but this is, what I was able to find. And the less diversity you have, the more sense of community you have, right? So I wanted to put this on the table because I hadn't seen that in a lot of the public health and especially mental health literature. And because we talk a lot in that about shared spaces, and public spaces by nature are shared spaces. And, I feel like this is a topic that is really worthwhile discussing with an audience like this, okay? So, to continue that, the diversity versus social inclusion, you can see that when you try to design pro-social, active, safe spaces, try to induce empathy, right? You can do that in buildings themselves. And for example, this shows a kind of a shared housing situation, where I found that, the size of the spaces matters. Whenever you have too many strangers talking to each other, you get a sort of sense of fear. So these things, and the same thing in outdoor public spaces. The idea here is more complex than what a design guideline can give you, okay? So I also think that these terms are somewhat culturally determined. I don't believe that one community will have the same how can I say, same attitude toward this relationship. Okay. Finally, I wanted to show you one of the projects that I did, not to show you the project itself, but rather to point out two themes that I felt would be good for this discussion. This is a park in public in Hell's Kitchen that I designed, and here it is. It's a little hard to see, but let me point out what I felt was interesting for this particular discussion. The park is very small. It's in the middle of what used to be a roadway, and it's a very small sliver The idea here that I think is pretty unusual is that it used an interesting way of creating this diverse, more inclusive, how can I say, design, by using history, by using the past, by using memory. This is called the memory garden and is based on historical layers that are to some extent reenacted here, not as a Disney-esque, recreation of history, but rather as a conversation starter and about an open conversation starter between different social groups. This idea was tried in workshops, and this is an ongoing project that may be built in the future. You can see old houses that were demolished on this site. You can see various fragments from history that are revealed and brought to the public's attention. The other idea that I think is very interesting here in terms of showing a gradient between sociability and privacy is this big long table, this gigantic table in the park, where people can gather close together and be together, but they can also sit apart as they wish. The last point that I wanted to make was the idea of actually giving people agency over their own environment. This doesn't happen very often in New York City public park projects, just because they get designed by good designers and they get implemented and people, of course, use them. But this particular design was designed more like an app where these planters, for example, were designed to be planted by local neighborhood associations. This one was going to be occupied by the church across the street. In other words, the idea was that to give people more agency and more customize their space. To me, that is an enormously important aspect that affects, I believe, everything from affordable housing, because people feel that they have no agency. They are completely a victim of their landlord. They have no, especially within the affordable housing crisis. And when it comes to public spaces, very few people are, involved in them. We of course have community gardens, which are the exact opposite. But what I'm arguing for, and what I'm what we're hopefully will be discussing, is how we can actually get more agency into the public space. Thank you very much.